All righty, good evening, everyone. An honor to be here. First, I want to welcome all of our guests and welcome everyone attending tonight. I know there are going to be a lot of questions tonight, but once again, want to welcome Dr. Ray and also Danielle Zuckerman, who've been doing outstanding work in keeping us updated on the facts, which is something I want us to pay attention to as we move forward. Let me just start by saying, since the last time I believe I was on this town hall, I received my Pfizer shot, had no side effects. I'm still walking, I'm still talking, I'm doing all right. My wife is still telling me I got to take the trash out, and I'm doing it. So everything is working out right on par. So I really want to stress the importance of us all still getting vaccinated. I know that there's going to be a lot of questions around J&J today, but we must all continue to get vaccinated. And I think you'll get your questions answered on that as well. I do also want to stress that we are making some progress in communities of color in terms of people getting vaccinated, but we're not out the woods. And we know that there's still a hesitancy here. I really urge you to still get vaccinated, all right? Once again, I'm standing tall, I think still. Well, I'm sitting today right now, but I'm still standing tall and want everybody to know that it's still safe to get vaccinated. With that being said, I'm not going to hold this up, but want to thank my staff once again, the phenomenal Brent Weisberg, who continues to ensure that these events happen. I think we may have some elected officials that join. If they do, the staff will certainly introduce them. But I don't want to belabor this any longer because I want to get down to what we need to do. I also just want to add that there are more sites being expanded. I don't know if DOH or Dr. Ray will talk about that, but Queen Center Mall has been added. We've had a few other sites, including a site in public housing in the Rockaways, Ocean Bay houses that was actually opened up as another additional site. And we know that there's still a whole lot more that needs to be done to make sure that every corner of Queens is receiving a permanent vaccination site. So that work continues as the supply ramps up. If you have suggestions, please don't hesitate to get them to Brent, who will take over this meeting. I have to hop on to another one. But please don't hesitate to get us those locations as well. So with that being said, I'll turn it over to Brent to introduce our guests. And I want to thank the staff here at Borough Hall for all of their continued great work in making sure we improve the rates here in Queens. So thank you.
Thank you so much, Borough President. It's my honor to have Dr. Ray from New York City Health and Hospitals back with us today. She did a phenomenal job in our last town hall, and we are so privileged to have her back for, I believe this is our 7th one in our series. So thank you so much to Danielle and Dr. Ray. Thank you so much. Take it away. DOHMH, Department of Health, not H&H. Excuse me for that. Dr. Ray, take it away.
Thank you so much. And a lot of respect to my colleagues at H&H. I wouldn't mind being from there. So yeah, today is a very big week. I think in the, since I last spoke to you, vaccine eligibility has expanded to everyone over 16 years old in New York City. We talked a little bit about that last week. But, at the same time, we actually also hit our 5 millionth vaccine dose delivered in New York City, which I think is a very, very big milestone. At the same time, although we've seen stabilizations in COVID rates COVID transmission is still high in New York City, higher in some neighborhoods as always than others. It's still really, really important to pay attention to what we call the core 4 behaviors, which is washing your hands, staying home when you're sick, wearing that face covering, and in fact, 2 face coverings. My colleague can put a lot of guidance on that. We have detailed guidance on how to wear those face coverings. And now I've missed one because I went out of order. Wash your hands, and then stay 6 feet apart. Additionally, get tested frequently. Testing is available really widely in the city, also for free all the time through our colleagues at H&H. The other big news that I'm sure all of you have heard about, and I'm going to keep this short so we can get to questions about that, is that there are, they've discovered a possible adverse event that's still being investigated in the Johnson & Johnson vaccine. So I think I spoke to you guys last week about how the Johnson & Johnson vaccine is a kind of vaccine called an adenovirus vaccine. And they have found through the vaccine adverse events reporting system, there are 6 cases that have been discovered in women between the ages of 18 and 48 of serious clots in the veins around the veins that are associated with the brain and the face. And that's called a cerebral sinus thrombosis. And while clots in the deep blood veins in general are really common, it is uncommon to see those in this age group. And so, the Johnson & Johnson vaccines across the country have been put on pause by the CDC so that formal investigation can be started, so that physicians can be, and other healthcare providers can be made aware of what to look for, and so that we can establish a case definition and really, a treatment algorithm and a treatment protocol if these cases are recognized. I want to say that there have been 6 of these cases in over 6 million doses of Johnson & Johnson given across the country. And that, at this moment, there are a lot of things that you hear when there's a possible adverse event identified. This is the system working. This is the system at work. This is not something where everybody who has had a Johnson & Johnson vaccine needs to go through any process. It's not like a recall on your car. This is an extremely rare side effect. That being said, in the past couple of weeks, if you have had a Johnson & Johnson vaccine, you do want to watch out for things like headaches, for severe headaches. You want to look out for abdominal pain, for pain in your legs. I know these are non-specific symptoms, and I do want to say that, again, these are extremely, extremely rare, but it does not hurt to get evaluated by your healthcare provider. I think otherwise I'm just going to talk a little bit about the science behind these extremely rare clots. They appear to be related to the immune system and to an immune, an incorrect immune reaction that causes sort of at the same time causes your blood to clot, but causes your platelets, which are a really strong mediator, a strong thing that your body uses to create clots. Your platelets go down, but at the same time, your clotting goes up. And this is something that we've seen previously with the drug heparin in some people. There is an antibody that is associated with what we've seen with the drug heparin. The treatment for that is something called intravenous immunoglobulin, which is a disease based on antibodies and collected antibodies, and of course using a different agent to dissolve the blood clots. It's unclear whether these are exactly the same thing, but there have been, again, a very small number, but there have been a very small number of similar clots that, based on papers released today, actually, and in the last couple of days, where it looks like there is a causal relationship with the AstraZeneca vaccine, which uses the same science. It is also what we call an adenovirus vector vaccine. And happy to go over that science again as well. And that is something that it looks like maybe you will be able to test for with a laboratory test for those antibodies. And I think with that, let's go to questions.
So Dr. Ray, surprisingly enough, first question. All right, there weren't any questions when I just said that. There we go. Are there any recommendations for actions to take immediately following or prior to vaccination to offset in any way potential side effects, such as taking aspirin or any preventative recommendations?
I want to remind everyone that this is an extremely, extremely rare phenomenon. And so most drugs that you would take, including something that seems as innocuous as aspirin, most drugs also have side effects. And for something that's less than 1 in a million, you wouldn't want to encourage everybody to take an anti-clotting drug, because remember, if, preventing clotting, like clotting exists in most people's bodies when it's occurring within the normal limits, it exists for a very important reason. And so you wouldn't want to take a drug that could potentially have more adverse effects than the thing that you're trying to prevent. Of course, people who do take aspirin regularly should continue to take aspirin. And it's, if you are worried, you can always talk to your doctor about it. But at this point, it doesn't appear that there's any need to do that.
Dr. Ray, from my understanding, the 6 folks that were affected by the J&J were all female. Any insight as to if that's just a coincidence, or if there's something there to that? What does that look like?
Well, I think the work on the AstraZeneca vaccine around these clots, and we don't know if it's the same thing. We don't know if we can lump those two together, but if they have any similarities in the AstraZeneca cases, there was also females were twice as likely as males to have this. Again, it's a really small number, so it's hard to draw patterns, but it does appear that there is some connection with the immune system. And for many autoimmune diseases, for a whole constellation of reasons, for a whole bunch of reasons that we haven't identified or we don't know, women are predisposed. And, when I say women, I'm talking about, the sort of hormonal milieu and picture that has been, that we're talking about when we say women. I'm not talking about a gender identity.
If we could go back to the science and just talk about the difference between Pfizer and Moderna as opposed to the science used in developing like a J&J, I think that would be prudent.
Yes. So the Pfizer and Moderna and these J&J and AstraZeneca vaccines, and again, I won't go into all the details of it like I did last week, but basically both of them work the same way in that they allow the body to read a small piece of a blueprint that allows it to produce a piece of the COVID vaccine, which is a single protein that is associated with the COVID vaccine. And in the future, then the body can, use that information, that small amount of the COVID vaccine, COVID virus protein, to learn what the COVID virus, the virus that causes COVID-19 looks like. The difference between one of the big differences between Pfizer and Moderna, and on the one hand, and J&J and AstraZeneca on the other hand, is what they use, sort of the casing they use on that blueprint material, on the actual material that is used to get the real, meat active ingredients of the vaccine into a cell. And for Pfizer and Moderna, they are, and it's a little bit more complicated than that, but it's basically a small drop of fat. For both the AstraZeneca vaccine and the Johnson & Johnson vaccine, they actually use the shell of a common human virus called the adenovirus. And that there are slightly different versions. So the AstraZeneca vaccine uses a version that was isolated from chimpanzees. The Johnson & Johnson uses an inactivated human version of the adenovirus. But it's really unclear what the implications of that are. I mean, I was talking to one of my friends, and of course this isn't scientific, but maybe something that we didn't know the cause of was actually related to a large number of people, to people being infected with these normal viruses as colds every year.
When you say casing, what does that mean to a layperson?
Mm-hmm. So the genetic material is, in the virus, everything, all the active ingredients that we're using in the vaccine are designed to be kind of used for a very brief period of time, just long enough for the body to act on them and develop immunity, and then to dissolve, right? And then to go away. And so they're not that stable on their own. They also can't get in through your cells on their own. So they need something to sort of carry them. And I use the word casing because they need something to carry them inside a cell. And these adenoviruses, or, they're a very common cold virus. And very often when you talk about the common cold, you're talking about an adenovirus. These adenoviruses are good at getting into cells. It's part of the reason that the J&J and AstraZeneca vaccines are much easier to transport and much easier, you don't have to put them under these very special freezing and thawing conditions. And they were part of a virus's job is to get into cells. And so that's why they were picked to get the vaccine, to get the actual functional part of the vaccine into a cell.
Great, thank you. We have a couple of questions in the chat here. What is the time frame, days, weeks, etc., to pass through the threshold of any concern related to the potential clotting side effect?
Mm-hmm. So, like we said, this is a new condition, but side effects were all for the J&J patients. Those 6 patients were all identified within 2 weeks. It was between 3 days at the earliest and 13 days. The AstraZeneca cases one was identified, the longest one was 20 days. So it does appear that, 3 weeks at this point seems like the extreme of the threshold, but of course we're learning more every day.
Great. And considering any questions, concerns, or hesitancy related to the J&J vaccine, can a person request or reject the J&J vaccine in place of the other 2 dose vaccines?
At the moment, that of course entirely depends on the site and entirely depends on the availability and the procedures and protocols. At the moment, all Johnson & Johnson vaccines, there's a pause on administration of all the Johnson & Johnson vaccines.
Is that countrywide or is that state and city only? Because we heard that Governor Cuomo and Mayor de Blasio had paused that today and have opted for Pfizer or Moderna if you have a J&J appointment. But I'm assuming that's a nationwide pause. Am I correct?
So the CDC has issued the policy for the whole nation. They actually put out a health alert on it. Danielle, you can correct me if I'm wrong because I'm not familiar with all the legally what other states are allowed to do, but certainly, New York State and New York City were very, quick to adopt this pause. And I do want to reiterate that this is not a recall like you have when there's something, a manufacturing error in your car. This is how the system is supposed to work. We have a system to identify events. We were able to identify this when, after 6 cases out of over 6 million doses administered. And now we need to take a pause, determine, how the best way to identify this is, what the best approach is. I don't know what the recommendations are going to be in the coming weeks, but I will say even with, the work on AstraZeneca has been done longer. many of the things that, many of the drugs, many of the things that we do in our daily lives that are associated even with big risks are, this sort of number, like many other things. If there were a medication that provided a great benefit, there are many medications that many of us take every day that do have a higher risk profile or a higher risk of adverse events than this. So we're just gonna have to see what the consensus is after we all put our heads together and figure out the best way to move forward, the best way to define these cases. And we also want to make sure that, in the rare event that these cases do occur, if we resume these vaccines, that doctors are really well versed in them and are not sort of on their own in terms of what tests to order and, what threshold to use to diagnose someone, what treatments to provide, and when.
So for the J&J, and I think you alluded to this earlier, if you identify that you could potentially be susceptible to this clotting, you said that there was somewhat of a pre-screen you could get to see if you're susceptible to that. Do you see that being something that would maybe be instituted in order to bring J&J back online? And I don't want to put words in your mouth. I should say we're speculative at this point. We're just speculating here.
Well, we don't. So I don't know of any pre-screen, but for the condition that I spoke about earlier, that appears to have some similarities with this clotting. That condition is called heparin-induced thrombocytopenic thrombocytopenia, which is a mouthful. You can call it HIT if you don't want to say all those words. But it does seem that that condition you can measure the antibodies that are either mediators or cause that condition. And so when someone is in the early stages, it is possible to do laboratory tests on that. And of course, that brings up a whole other, there are of course false positives with that test. There are false negatives with that test.
It's a whole other layer down the road that we're not even talking about. So I'll move on because
I'll actually add one more piece though. One of the things is I mentioned that the blood clots occur, but people's platelets get low. And when you get your routine labs tested, a very easy, very inexpensive test that we have measures the number of platelets that you have. And it does appear that low platelets, so that number dropping to a low level, is an indicator, and it's a good, quick, inexpensive way to tell if that condition's happening. Obviously, we will learn more as time passes.
Thank you so much. Question: if a person has any current health issues or concerns, is it okay to get a vaccine? This is the caller, if you will, I've recently developed cellulitis and have had allergic reactions to antibiotics prescribed. Should I be getting a COVID vaccine or should I wait?
So I think, and we touched on this earlier, the way I think about, and we acknowledge, and we've always acknowledged that there could potentially be risks associated with the vaccine. Based on what we've seen so far and based on all of the science behind it, they're small risks. But the way I made my decision, the way I take tell other people is a good way to make your decisions around any medical procedure is, weighing the risks and benefits of doing it against not doing it. And for someone with underlying medical conditions, many people with many underlying medical conditions, we're learning about more and more underlying medical conditions that can every day, but the risk of having COVID is really dramatic, and it is a real risk that you run every day by going out in the city, by just living in the United States, honestly. New York City was the number one for COVID transmission, not a great number one. I think when we talked last week, New York State has fallen out of being the number one state. And Unfortunately, it's not because New York State is doing tremendously better. It is because I think Michigan has overtaken it, but it is because Michigan has seen an increase. And so, just by being in the United States, you run a pretty big risk from COVID. And we know that that risk is significantly decreased if you take the vaccine. So I still encourage everyone to take the vaccine that is available to them. There was a question about allergies, and if you are allergic to a component of the vaccine, it is quite possible you will have an allergic reaction, right? But those other allergies you mentioned, the allergy to penicillin, for example, since there is no penicillin in any of the vaccines and there's nothing cross-reactive with penicillin, you should still be fine to take the vaccines. Now, if you've had issues with vaccines specifically in the past and you've had severe allergic reactions, or if you're nervous about it, or you can definitely talk to your healthcare provider about it, but that one is not a specific reason not to take the vaccines.
Thank you. Next question. I had GBS from which I never fully recovered. My PCP recommended consulting my neurologist prior to getting vaccinated. Would you agree that this is advisable for people with autoimmune conditions?
Mm-hmm. So a couple of things. So the CDC has actually exactly addressed this issue. I think previously, there are previous vaccines that have been shown to have an association with Guillain-Barré syndrome. This vaccine does not, there is nothing in the studies and no evidence that shows that there is an association with Guillain-Barré syndrome. And, if you watch 1 million people, if you watch 5 million people, if you watch several million people, some of them will develop Guillain-Barré syndrome kind of no matter what, even if you don't give them any treatment. And so it does not appear that this vaccine causes Guillain-Barré syndrome, and that is something that has been investigated and that we're pretty sure about worldwide, and that's for any of the vaccines out there. I will never tell anyone not to consult their healthcare provider. I am not examining you in person. I'm not familiar with your medical history, but I will say that Guillain-Barré syndrome specifically is something that should not be a contraindication to getting the vaccine. Autoimmune disorders, I think there are fears on both ends, one that the vaccine might not work as well, and one that the vaccine might have unanticipated immune effects. And we haven't really, if you take the whole bucket of autoimmune disorders, we haven't seen that for the whole bucket of autoimmune disorders. And it is something that there's been some investigation into. It's hard, sometimes to classify autoimmune disorders. I can tell you, I have an autoimmune disorder and I did not hesitate to take the vaccine.
Thank you so much. Thank you so much. For persons over 75 years of age living in Queens, can they just go to a vac site without an appointment? What can be done for a senior citizen without a computer to obtain the vaccine? I'll speak to the second part of this because I think that's where our office really shines in this kind of world. We've been helping many, many people, many constituents who have contacted us. We've helped schedule them for vaccines. So I'm happy to put in our office number here. Feel free to call us at 718-286-2680. And that's my line, and you could call us and we can help you obtain a vaccine appointment to the best of our ability. And to the first point, and Dr. Ray, you're obviously welcome to expand on this, but Citi Field is a walk-up site for those 75 and older. So you could just go to Citi Field, walk up, show and say you want the vaccine, and there you go. So please correct me if I'm wrong.
I can take this one. Thanks, Brent. I'm putting in the chat the link to a flyer, and it lists all the sites in Queens that have walk-ups for New Yorkers who are 75 and older, plus an escort who's eligible. So that's 16 plus if it's Pfizer, and then am I right, Dr. Ray?
Yes. Yeah.
And then for Moderna and Johnson & Johnson, well, Johnson & Johnson's paused, but so that list of sites, it has a bunch of sites in Queens where you can walk up. This list gets updated weekly. So you can go to nyc.gov/VCC for the Vaccine Command Center's website, and we issue new flyers based on, what's going on with the site. So you should keep tabs on there. But for this week's flyer, you can go to any of those Queens sites.
If you go to the LIC site, you might see me this weekend. So in case you want to meet me in person.
It's a good plug right there. Question in the chat. My wife and I were tested positive in February. I got my vaccine April 5th, but my wife has doubts because she takes a lot of medicine because she has a heart disease. Could you tell me if the vaccine is safe for her, please?
Yeah, and I think it's a similar thing. So people with heart disease of just about any type, heart disease in general is listed together with high blood pressure as an underlying medical condition that puts you at greater risk on the CDC's website, greater risk if you get COVID-19. And I think really anybody with a serious medical condition, like you really just don't want to add COVID on top of that. That is something where we are learning more and more about the potential impacts of COVID. There was a recent study that said over 30% of people, even people with mild disease, even people who are otherwise healthy. Sorry guys, my cat wants to say hi to you. Even people who were otherwise healthy are noticing long-term effects of COVID months and months after they have the disease. I think adding that on top of another underlying medical condition, it's something that I wouldn't want to do. It's not something that I would advise my family to do. And so I would say that it's probably more important than maybe it is even for others for your wife to get the vaccine. I think having COVID in February, I hear a lot that people who have had COVID in the past think that they are safe. And unfortunately, we are seeing more and more cases of reinfection with COVID-19. From what we know, it seems like the immunity that the vaccine gives you is better than the natural infection immunity. And so we still suggest that everybody get the vaccine, even if they've had COVID in the past. Now, I know that some people with underlying medical conditions who get COVID are given a treatment called monoclonal antibodies, which is a great treatment. And actually, my colleague can put the link. We have some information about that, can put a link in the chat. If you do have COVID and you're over 65, if you have underlying medical conditions, you might be eligible. But if you've had that, then we ask you to wait 3 months, only because some of those monoclonal antibody treatments can linger around in your system and they can impact the way you're developing full immunity from the vaccine.
Thank you. And similar to that, a follow-up question from the individual: how frequently can someone get tested? At Citymd, they told me to come back in 3 months to test again. So to your last point, which you just touched upon.
So the problem with the tests is that for reasons we don't really know for sure, people who've had COVID sometimes can have residual genetic material from the virus in their nose, in the area behind their nose and mouth, which is where we test for COVID. And so the worry is that even if you get a positive test in the 3 months after you've had the virus, we won't know what it means. Does it mean that it's just this sort of hanging on positive tests from before, even though you're not transmitting the virus, or does it mean that you have the virus all over again? We know that within the first month, it's extremely unlikely. It's probably unlikely you'll get COVID again within within 3 months. But of course, we've talked before about different variants and how COVID is, how SARS-CoV-2, the virus that causes COVID, is evolving. And so if you have symptoms of COVID, you should definitely isolate yourself. Just act as if you are sick if you do have those symptoms. And then talk to your healthcare provider, because at that point it may be worthwhile to get a test.
So this is a great question coming up, one that my office has been trying to investigate all day. I don't know if you have an update to it, so teeing it up here. What is happening with the city's Homebound program for seniors that have not yet received the vaccine, and now that J&J has been paused from being administered?
To my knowledge, the Homebound program has been paused. I am not sure about any alternatives that are in place yet. I think I can see if Danielle has heard about anything, but if not, it's something that we can keep your office updated on.
Please.
Yeah, Dr. Ray, you're right. Right now it's paused. As many of you know, we didn't really get the Homebound program going until the Johnson & Johnson vaccine was available. Like Dr. Ray was talking about earlier, both the Moderna and the Pfizer vaccines have really strict requirements on storage and transportation. So we are waiting for updated guidance on the Johnson & Johnson vaccine before we talk about resuming that program.
And the folks that were vaccinated with the Homebound vaccine, is there any thought in light of today's news for follow-ups with them, just checking kind of things? Has that been discussed or no?
I don't know the answer to that yet, since the news is, pretty late breaking today. Just a reminder that this is, and this is an extremely, extremely rare condition. We are actually seeing it mostly in persons between the ages of 18 and 48. Of course, it doesn't, with 6 cases, it's really hard to generalize anything. But I do think, for providers, it's a good thing to follow up with clients if they are your regular clients. If there are persons that a neighbor, a family member, if it's similar to, with anything, I would say it's a good time in the context of COVID to follow up with everybody. If somebody's recently gotten the Johnson & Johnson vaccine, I would just remind you that what is much more common is COVID, and that at the time, it does take 2 weeks for you to get immunity to the vaccine. So if a person did happen to be exposed to COVID beforehand, that's something that is a sort of a constant reality. We'll update you about any follow-up plans as we hear about them.
Thank you. I don't really know how to present this question, but I'm just going to say it because it's basically what we've been talking about the whole time. So it's kind of 2 questions in one. One is the Johnson & Johnson vaccine safe? And the other one is, I came in late. What is the status of the Johnson & Johnson vaccine after today's news? However, to the first point of if it is safe, the B part to this individual's question, which I think you really need to emphasize, is when can you take the other vaccine if you've already taken the Johnson & Johnson vaccine? So there's a problem in that thinking there. So Dr. Ray, please clarify.
Yes. So I think there's a couple there. So I'm going to kind of go in order. And if you guys think of something else, please let me know. So I'll start with part B. But so the Johnson & Johnson vaccine is a 1-dose vaccine. And so there isn't a secondary dose that is necessary. Additionally, there is no question about the effectiveness of the Johnson & Johnson vaccine. So this is, and I think I'll touch on the other question, but although there is a pause right now in administration of the Johnson & Johnson vaccine, that is, it's the number one COVID phrase, which is an abundance of caution. But this is the adverse events system working the way it's supposed to. This is us very early identifying an extremely rare possible adverse event developing a definition so we can document it, really taking the time to understand, what to do about it, how to treat it, understand how to define it, how to track it, and understanding what the real impact of this is. The numbers are less than 1 in a million right now. And so I think that, that being said, if you are one of the people, for example, at one of the sites where the Johnson & Johnson vaccine was being offered, and now those appointments are being offered Pfizer instead, take that Pfizer vaccine. Take the vaccine that you can get as soon as you can get it. And I think that actually answered the first question as well, that there is an appropriate pause to conduct investigations and to share information and to, sort of calmly and with the consensus of a lot of scientists and a lot of different brains, define the next steps.
And you would say that Pfizer and Moderna obviously are still safe to take in light of anything. We're just making that clear.
Yes, absolutely.
A question that was actually presented in our office earlier today, under the context of what we're discussing here, is someone had the belief that it's possible that those on birth control, being more susceptible to clotting because you take birth control, we're under the theory that there's maybe a link between the clotting we were seeing with Johnson & Johnson and those on birth control. Is there any science to back that or thinking? I know it's so new, but just a hypothesis that our office was presented with.
So among those 6 persons, there doesn't appear to be, according to the CDC earlier today, there doesn't appear to be a relationship with it. Of course, in the 6 patients who did develop this condition had, as we said earlier, sort of the hormonal, like what we call I don't know how to describe it, like a female hormonal profile, right? Which may, which we know is related to clots. This is a little bit different than the kind of clotting that you do, that you often see with birth control. This is kind of a rare, very deep vein clot. This is not something that is usually seen with the clotting related to oral contraceptives. But I do think it brings up a point that, many drugs do have adverse effects, and it is an individual decision to think about the risk of that adverse event versus the benefit. And before this, it's always tricky. If somebody's allergic to something, when they have an allergic reaction, it's sort of a different kind of adverse event. This is one of the first new big ones that we're discovering. And so I think it is, it can be scary, except that, you have to realize that this is something that happens with every treatment, or can happen with every treatment, and it's something that we have prepared an entire infrastructure for. The oral contraceptives is one of the first questions people asked. People asked if there was an association with pregnancy. Were any of those 6 persons pregnant? There doesn't appear to be, from what the CDC said today. There isn't a whole lot of information out there that I can give you beyond that.
No problem. Thank you, Dr. Ray. Question in the chat. Sorry, can you repeat how long after vaccination with all 3 vaccines your body has full immunization? People say 14 days, others say 30, others say 50. So
all the tests were done on 14 days. So the numbers that you hear, the 95% effective numbers, those 95% are at 14 days. And everybody's immune system is different. Right, so that's sort of a population level number. So an individual will develop full immunity on a spectrum. But the 14 days is the number that we recommend because I don't know what your immune system is doing versus my immune system versus Danielle's immune system. And the number where we're pretty sure that 95% of the population has immunity is 2 weeks after the vaccine. Now, there have been some statements that, there's been some speculation that there is greater immunity developed after 2 weeks. I would probably not go earlier than 2 weeks because then you run the risk of not being immune yet. But is it possible that you as an individual will have stronger immunity after 2 weeks? Yeah, sure. Probably after a month, you'll have, a whole lot of immunity. It probably does increase up to a month, maybe longer. But I think that there's a couple things, like one, people have asked about, spacing doses out longer, and does that help, and is it better? There isn't really evidence that it's better right now, and I think not everybody is immune after the first dose of the vaccine. Not everybody has really, any significant amount of immunity, and so I think studies were designed with a combination for the 2-dose vaccines of making the time to full immunity as short as possible while still having enough of a space between the first 2 vaccines that you could develop a strong immune response.
Thank you so much. In our chat, so if the Pfizer vaccine has been substituted for J&J at the mass vac sites, then why did the Homebound program need to be suspended for guidance? What if a homebound person does not want to take J&J and prefers Pfizer or Moderna instead?
So, and I think that Danielle alluded to this, but the transportation and storage requirements for the Pfizer and Moderna vaccines are much more complex than for the Johnson & Johnson vaccine. And that's why the Johnson & Johnson vaccine was primarily allocated for homebound persons. And that's because it's really mostly around refrigeration requirements, freezing and refrigeration requirements. And as you can imagine, if you are, every vial of vaccine has several doses in it. And once you open that vial, it's got a clock on it. And it's different for Pfizer and Moderna, but it's a couple of hours. And so if you're trying to get let's say 10 or 11 doses in a Moderna vaccine, if you're trying to get that out to 10 people in a period of 6 hours, that can be quite complicated.
Sure. Now, I will say, if you are someone that wants a Pfizer or Moderna vaccine and are willing to go to a vaccine site, again, our office can help facilitate that. And if you are someone that, I won't say is completely homebound, but a homebound senior or a preference to being homebound, the city does have a transportation program, I believe, right, Danielle, where if we schedule an appointment, we can also, via the mayor's office, via the city, help with transportation to and from that vaccine site. And our office's contact and emails in there. And Danielle just added 877-VAX4NYC to arrange transportation.
And I will say that, most sites, I actually don't know of any site that will give you your choice of vaccine. I think most sites have one vaccine. That's actually a best practice for a mass vaccination site because, you don't want people to have, none of these are available as single dose vaccines. And then of course, once you draw something up out of the vial, if you have 2 different vaccines on the table, you could potentially get confused as to one or the other. But if you go to our Vaccine Finder website, we do say which vaccine is available at each site where you can book an appointment. And so you can, if there are, let's say, 2 potential sites with appointments available, you could pick the one that has your vaccine of preference. There's no known difference between them. Different people have reported, you might say that some, my friend had Pfizer and didn't have side effects. My other friend had Moderna and had side effects. There are a couple, maybe one-off different things that we hear, but nothing is really solidly proven, and nothing is consistent enough, certainly from what I've seen or heard, to say that one has more side effects than the other. And I think people like Pfizer because you can get your second shot a week earlier. But the recommendation is still to get the first vaccine that you can. But if you do have that preference, every vaccine is an individual decision. And so I encourage you to check out that feature on our Vaccine Finder website.
A couple more questions. I know we're on a tight time frame. What's the science in the spacing of the first dose of the vaccine and the second dose? Why is it taken in 2 different sessions?
Mm-hmm. And I always talk about this, like when I was in medical school, if I crammed everything the night before the test, I might do okay on the test. But if you brought it up to me again later, when it was important, when I was seeing a patient, I might not remember it at all. But if I spaced out my studying, then I'm much, much more likely to remember that information when it counts. And that's how I describe the spacing for the 2 vaccines. And the reason that, the Moderna and Pfizer, one of the speculated reasons that you might need 2 doses for both of those is that with those, those little tiny droplets of fat that we use to get it into the cells, they may not be as sort of immunogenic. They may not be as good at automatically generating an immune response because your body's not used to seeing little blobs of fat as something like the Johnson & Johnson vaccine, which is housed in a virus, which the body is used to saying, hey, viruses are bad. That's a speculation. I don't know. The AstraZeneca vaccine requires 2 doses, and it's in, its sort of transportation medium is very similar to the Johnson & Johnson. The other thing is, that's the sort of high level theory behind it. And the other thing is that's the way the tests were done. Part of the fact, and I think we discussed this before, but part of the things that happen with an emergency use authorization is not that the testing wasn't exhaustive, because it was, but very often when drugs are released, they'll test them for every possible benefit. They'll test them, they'll say well, it's inconvenient to wait 4 weeks to get a second dose. It would be much more convenient to get everything in 1 dose. And so the testing wasn't done on how to make this the most efficient thing possible, because we didn't want to wait to save lives until all these different variations could be tried out. Once we had something that worked, we went with it.
Great. Self-explanatory, but are the COVID-19 vaccines interchangeable? No, they are not, right, Dr. Ray? We could talk about that for a second.
Yeah, they are, and we'll say at this time they are not. You should really get the vaccines. If you got one type of vaccine in a first dose, you should get it in a second dose. I think the question is coming up again because people who had gotten first doses of AstraZeneca, especially young people who maybe weren't taking AstraZeneca in Europe, were offered other vaccines as a second dose. And I think in Canada as well. I believe it's on hold in Canada as well. But at the moment, we don't recommend that, and most sites won't let you. I don't know of any sites that'll let you do it. If you did somehow get 2 different doses of 2 different vaccines, I think that's sort of an individual. It's an individual case. I doubt anyone would tell you to restart the series, but it is unknown exactly how strong your immunity would be. It's unknown how that would compare to people who got 2 doses of the same vaccine. And it is unclear what adverse events might come out of that because, again, it wasn't tested.
Thank you. I will say, if you did not schedule your second appointment once you received your first appointment, I've heard some constituent cases like that where they actually were not given a schedule. Our office is trying to help facilitate and hammer that out. So obviously feel free to contact us there. I don't know if you have any closing thoughts on that. I'm seeing no more questions here, and we're on a tight schedule. So any last thoughts for us, Dr. Ray?
I just want to thank my fellow Queens residents for tuning in. I was really glad to talk to you about this, and I think that, you know, my thoughts are, one of the things that has gotten me through, and I think gotten all of us through this pandemic, is that we are learning something new every week, right? And so to get information from trustworthy sites, and Danielle can put, I'll just tell you, nyc.gov/health/coronavirus. We update it all the time. There's a ton of good stuff there. And, you know, be calm and think about, you know, and we can all have conversations about all of these issues.
Absolutely. And our office's info is in there as well, 718-286-2680, along with my email address. We hope to do this again. Thank you, Dr. Ray. Thank you, Danielle. We appreciate you all taking the time. Have a good evening. Thank you.
Have a good evening.